In this lesson, we're going to take a look at some mechanical aids that will help your patient and their mobility. Before we get started on the ins and outs of the different types of mechanical aids, let's go over some pro tips when you use these and when you educate your patients on them. If you can think about these main points as we go through them, it'll help you to better understand them as we discuss them and as you go forward. First off, mechanical aids are really designed to help promote exercise and mobility. So as you educate your patients, teach them how to use them and to think about if the aid is actually hindering them or helping them. If it's hindering them, find out why. Why is this happening? Remember, they're aids, so they're not designed to do the work. The patient actually has to do the work. So if the aid is actually hindering their progress, then you need to figure that out. Also, and more importantly, focus on your patient's safety. Make sure that when your patient is ambulating with these different types of devices, that they don't have any like tripping hazards in front of them and that they can use them safely and appropriately. When you're using physical therapy and occupational therapy and they come in to educate your patient, go watch it with them. Remember, nursing is a lifelong learning career. It's a process. So make sure that you're always freshening up on like your cane skills. If your patient's not understanding your teaching, go grab PT, go grab OT and have them help you out. We're going to cover a few different devices today, and we're going to go over some general fitting guidelines, but really pay attention to what the manufacturer says whenever you're trying to fit your patient for whatever device they're using. So let's get started. The first one we're going to look at is the cane, the good old cane. There are several different versions of these. They come in like your standard form or this guy right here, which is the quad cane. They all have these rubber stoppers on the bottom. And there's one other one that you're going to see, which is a tripod. It looks kind of like this, has just these three legs out here. But all of them have this little stopper, and that's for a safety issue. And they're really all for user preference, so everyone's going to be a little bit different. The wider base seen here is going to offer a little bit more stability for your patient. So just keep that in mind if your patient needs something a little more stable or they have more of a single-sided weakness. So the thing that you really want to focus on with the canes is that they provide support for a one-sided weakness. So what you want to do is when you're teaching your patient that they use the cane on their strong side. There's this misconception they need to put it on their weak side. But what you want to do is you want to have it on their strong side, and the cane handle should be at the height of their hip. Then what they want to do is your patient should step with the affected leg or the weak leg and move the cane at the same time. Then once they're leaning on the cane, then step through with the strong leg. The cane is really an extension of the arm, so make sure that they're bending a little bit of that elbow. But the thing that you want to remember is that the cane is there to help them with balance and to stabilize themselves. If you need to, go grab occupational therapy or physical therapy and have them help you demonstrate it. So now let's take a look at walkers. There are a couple of different types of walkers, and you'll see this standard one, and then you have this cool nifty one with wheels. The one with wheels are great for people that have better control and if they need to sit. But other than that, a standard walker is pretty solid. Walkers are used for generalized weakness. So you want to make sure that your walker is appropriate for your patient. When you're using your walker, make sure that the handles are as high as the hip. And when your patient goes to move, they should move the walker first about 6 inches, and then they should step with their weak or affected side. And the reason you want to do that is that you're going to provide some stability through the arms, and you can move that, and the back leg, which is a strong leg, is going to offer some stabilization and balance, and then they can step forward with their strong leg. And so they always move the weaker leg or the affected leg first or side. Sometimes your patients are going to need to get out of a chair. So let's draw a chair. Right. Then you've got your walker. Right. What you want to do is make sure that the walker is not too far in front of them. If they do, then it becomes a safety issue and they could potentially fall. So what you want to do is you want to make sure it's close to them, and they're going to grab here on the handles, and then they're going to pull themselves up using their arms, and then sometimes these chairs have armrests. Have them reach back and place an arm on an armrest to stabilize themselves. And then once they get their bearings and their balance, then they can start moving forward. But make sure that you stay behind the patient right here, just to make sure in case they fall backward that you can either scoot the chair in front of them or provide some stability for them. But you always want to make sure that you're there to catch them. If you need to, again, go grab PT or OT, and then they can do their education with them again. But you want to continue to make sure that you're educating and you're reinforcing the education. So now let's take a look at some crutches. There are several different types of crutches, but the most common one that you're going to see is this, which is the full-length crutch. This crutch extends all the way from the floor to up to the armpit. What you want to do is make sure that the patient doesn't have this arm pad directly underneath the, that it's not pressed directly against the armpits, and that can cause injury either to the shoulder or to the armpit itself. It should be 1 to 2 inches away from the armpit onto the arm pad. And you also want to make sure that your patient is never putting weight directly on the shoulder, but they're actually extending through the hand and through the forearm, because that is where they should be putting all their weight, because they're an extension of the arm. Now, when you're educating your patient on ambulation, what you want to do is you want to have them move the crutches forward first, and also at the same time with the weak leg. And then you want to have them step through with the strong leg and then repeat the sequence. So the crutches should really only move 6 to 8 inches at a time forward until they get the hang of it. Then it's the crutches and the weak leg first, and then they use their strong leg second. The tricky part of crutches is going up and down stairs. And when your patient is going upstairs, instruct them so that they use their strong leg first. So this is the guy going up first. So this is first. And then he's going to bring the crutches. He's going to stand up, and then the crutches go onto this. And then they stand, and you bring in the injured leg at the same time. And then they're going to go to, then it's strong leg here, and he steps up. That's once they're balanced, then they can go 1 step at a time. Never let them go 2 steps at a time. Now, when they go downstairs, it's kind of the opposite. The patient should use the crutches first at the same time. This kind of is dragging, but they'll usually bring it down at the same time. But the crutches are first, and then the strong leg. Again, don't let them rest on that shoulder, because we don't want them to hurt themselves. But it's crutches and weak leg first, and then the strong leg when they go down the stairs. Just make sure that they're taking the steps one at a time. In this lesson, we're really focused on mobility and definitely safety for our patients when they're using the mechanical aids. And we also focused on health promotion as well. So let's recap. When using your mechanical aids, make sure that you use physical therapy and occupational therapy to reinforce your teaching, and also use it as an opportunity to learn for yourself as well. When you're using canes, you just know that there's several different types, but the thing that you need to remember is you need to place the cane on the strong side of the patient. Walkers are great for generalized weakness, so make sure that your patient is moving the walker first and then step into with the weak side. Crutches. When you're going upstairs, make sure you step up with the strong leg first, and then step down first when you're with crutches first when you're going down the stairs. This is really focused on safety. Last but not least, make sure that your patient is using the right device. Make sure they're using the right mechanical aid, and make sure they're also using it safely and that they can demonstrate that they can use it. That's it for our lesson on mechanical aids. Make sure that you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.